I say, breathe in, breathe out, hold. And then I feel like I'm cheating because I hold like a tiny little bit of breath. So I was going to share my scan results in this video, but as I tried to record the other night and I was giving updates on my scan results and kind of taking everybody through the process of me going through my scans, I realized that I could probably break this video up into a couple videos that might be a little bit more helpful to people. The purpose of this channel originally started to help people find information that I was once looking for when I was first diagnosed. So I will stick to that for this video, and then I will make another video where I'm going to actually show a little bit more in detail my scans. I will show kind of what the scans used to look like, what they look like now, and then I will make a separate video where I give my update. So I apologize, I'm not trying to string you guys along. I just really want these to be more tactical videos that somebody else might see benefit out of. So I didn't really know what to expect for scan day or anything like that before I was diagnosed, so maybe this will help somebody else. So let's just dive into it and let's talk about scans. I, of course, am not medically trained in any way, shape, or form, but I thought I'd just share some of the information that I've learned over time through my diagnosis and some of the questions that I had along the way. So let's start with what type of scans that I am currently getting. So I currently go for an MRI. We do an abdomen and pelvis MRI every 3 to 4 months. And then I do a chest CT about once a year. My scan schedule is a little bit different than some other patients with stage 4 kidney cancer. And part of that is to do with the fact that we're mostly concerned with my liver, which is why I get MRIs instead of CT scans. MRIs have a little bit better imaging of the liver and allow us to get a better look at everything that's happening there. And that's our main concern and location, which is why we have me doing MRIs. Other patients often also get a chest CT more frequently than I do. The reason why we are not doing chest CTs as frequently for me is because we're not as concerned about it going to my lungs. We still are definitely watching because it could be a possibility, but I think there might be one case report of a oncocytoma, which is what I have, a really, really, really rare type of kidney cancer, metastatic oncocytoma, which is like super, super, super rare. But there aren't really very many case reports of it going to the lungs. The liver is typically the main site that there's case reports in, and sometimes bone. We are still keeping an eye on my lungs, but we're not scanning as frequently as other patients typically get scanned when they have kidney cancer. All right, so those are the type of scans that I get. The other thing that I wanted to cover is what the difference is as far as a experience perspective between a CT scan and an MRI, because they are quite a bit different. And this is something that I didn't have any information of. I just heard how much people were worried about scans, how scary they were, especially MRIs. I heard a lot of people talk about how frightening MRIs were and that they were claustrophobic and just really, really struggled with MRIs. I'm the really weird person that I would prefer an MRI any day over a CT scan. I haven't really met anybody else who prefers that as well, but MRIs are easier for me, and so I would rather go for an MRI. But I would always hear the opposite from everybody else, and it always freaked me out. So before I got one, I ended up coming on YouTube here, and I would look for what MRI sounds were because everybody told me they sound scary. So we'll talk through all of that. But basically, a CT scan typically is a lot quicker of a process and a scan to go through. So what usually happens if you're gonna go for a CT, it can vary depending on the scenario that you get the CT. So for example, when I got my very first CT scans when I was in the ER, I didn't have any like oral contrast I drank or anything like that. All they did is they started an IV and then they pushed the contrast through the IV. If you go for just like regular surveillance scans, oftentimes they'll have you drink a oral contrast, which is different from the contrast that you might see people drink from like PET scans. It's not that like smoothie drink. It's a clear liquid and you can mix it in with other things. I usually just drink it with water and I can't really taste it that much. But when I do that scan, basically I have to drink about 32 ounces of the liquid about 45 minutes before my scan. There's a little bit more waiting up front. But once you get back to the scans, It's pretty quick. You've got a big machine. It looks like this. This is one of the machines at MD Anderson. Then they'll flush your IV and then hook it up to the machine so that it can push in the contrast. And then they will leave the room. They'll be able to talk to you through the speakers. My very first CT scan, I was super, super nervous and super scared, and I really appreciated it. The tech talked to me the entire time and made sure that I was calm. I definitely was not calm, but he tried to keep me calm, and I really appreciated it. Typically, if they're doing with and without contrast, they'll take the images before the contrast goes in. So you'll lay there as they take those images, and then they will push the contrast through. They'll usually let you know before they do that so that you can be prepared for it. And that is what is different for me about a MRI and a CT scan, other than the amount of time it takes, is the contrast. I am not a big fan of the contrast. A lot of people get the sensation like they're going to pee their pants, which I do a little bit, but more than anything else, it really warms and like kind of makes the center of my chest burn. It's not painful or anything, it's just very uncomfortable. And so I don't typically like CT scans for that, but it passes very, very quickly. So I wouldn't say like that's something to be scared of at all. Honestly, like getting your IV placed can be more stressful than a CT scan at times. And so the process itself is not painful or anything like that. I'm not a big fan of that sensation. So basically, once they put the contrast through, you'll feel it move throughout your body, and then they'll take some more imaging. They might have you do some breath holds through the different imaging as well. That basically helps you keep holding still, and they can get some good images. And then it's all over pretty quick. A CT scan, I don't know the exact duration of it, but it usually feels like it's under 10 minutes. I don't know. It's a pretty quick process. Once you actually get on the bed, the machine started, it all goes by pretty quickly. And so that is what a CT scan has been like for me. One of the other things that I always wondered about CT scans is like, where do they scan? So oftentimes I would be scheduled for a full body CT scan, and I always thought that that meant literally full body. So we're going head to toe. But I've found sometimes when it's called a full body CT scan, what it really means is it's chest, abdomen, and pelvis. So it's like the middle chunk of your body. It does not include like your head or your lower extremities. So that is something that I wondered. So after CT scan, you're supposed to drink a lot of water to try to help flush everything out of your system. And then that's it. You're pretty much good to go after you've wrapped up with the imaging. And they will get results. It varies depending on where you're at. Sometimes the results come back the same day. Other places, it might be a few days. So, all right, now let's talk about an MRI scan. So what is the experience going for an MRI? So I have had a couple MRIs. I have had a MRI of my brain, and I've had an MRI of my abdomen and my pelvis. So the MRI machines look very similar to a CT scanner. Both the CT and the MRI, they will likely have you change into like the scrubs. Here's a couple photos to go back. With an MRI, it's really important that you don't have any metal on you, so they almost always have you change into it. CT scan, sometimes you might be another thing. So like I was in a hospital gown for one of my CTs, but oftentimes they'll just give you scrubs to change into for that as well. As far as the MRI goes, MRIs do take longer actually in the machine, but I don't drink contrast or anything like that beforehand. So overall, it's kind of close to the same amount of time, but you spend more time in the actual machine. So the more body parts are scanning, the longer it takes. So when I get an abdomen and pelvis, it takes a little bit longer than just when I do just abdomen. But overall, I'm usually in the machine for about 30 to 45 minutes. And that is usually for the abdomen and pelvis. I think when I did my brain MRI, honestly, I can't remember for certain. I want to say it was in that like 30 to 45 minute window as well. And for that one was a little bit more stressful for me. Basically what you do when you go for an MRI, you do a very similar experience of you get your IV placed, you change into your scrubs. They'll have you walk up to this thing that's going to detect if you have any metal on you. You'll do a little spin, make sure you don't have any metal on you as you're going in, because these are basically gigantic, powerful magnets. And then you go back into the room and you will lay on the bed just like you do for a CT scan. They will flush your IV and then hook you up to the machine for the contrast. And the contrast is different between an MRI and a CT scan. So an MRI, you don't get that like warming body sensation that you get with the CT. I honestly never really feel the MRI. It sometimes is like maybe a little bit cold, but I don't ever really feel or notice the contrast from the MRI. And what's different about an MRI is after you lay down and you get settled, they will lay something over top of you. It's how you capture the images. For the most part, it kind of just sits on top of you. It's not pressing hard, it's not heavy. It kind of just sits there so that it can capture the images. When I went for my brain MRI, I obviously did not have that on my abdomen. Instead, it goes around your head. And that is the one that was a little bit more stressful for me because it kind of goes all around your head and you can't really see a whole lot out of there, and you have to hold real still and not move. And so that one was a little bit stressful, but I still got through it just fine. And after you lay down on the bed, after they've secured the camera, they will give you a little squishy ball. This is the basically like help, I'm panicking ball. It's there in case you get claustrophobic or if you freak out and you need to talk to them. It's there to notify them so they can stop the scan and help you with anything that you need. They will also put on some type of headphones or earplugs, sometimes both, because the machine is very, very loud. That is what a lot of other people talk about, of like the machine is kind of big and scary, makes all these loud noises. It does make a lot of strange noises. It's magnets that are spinning around really quickly. And so the headphones and the earplugs are to make it so that is not so loud for you while you're in there. And one of the things that I learned very early on from another patient, which I really appreciated, is you can usually ask them to play music. So I listen to music with every single MRI that I have done, and it really helps distract me from everything that's going on. It makes it a little bit easier of a process for me. So I highly recommend listening to music if you want to while you're in there. For me, I made a hard and fast rule of I will never listen to my favorite songs while I'm in there because I do not want to associate those memories with that machine. So a couple things I've listened to when I'm in the MRI is I've listened to soundtracks of movies. So I really like Hamilton. I know I just said don't listen to things you like, but it's a little bit different for me for that one. It's not something I'm just like listening to on a daily basis. And so I got diagnosed around the time Hamilton came out, and I was listening to Hamilton soundtrack. So I have listened to the Hamilton soundtrack several times while I'm in the MRI machine. And I've made that request a couple times. For me, that helps because it's something that I've seen. So I'll be listening and I'll like visually be picturing what's going on, and it's a really good distraction for me. So if you like any movie soundtracks or musicals or anything like that, I highly would recommend that. It's been helpful for me. And then sometimes I've just asked for just like general radio stations, and this last time they put on spa music, which honestly kind of put me to sleep. But yeah, so you can definitely make a request to ask for music to be played. You have to make sure that you can still hear their instructions. So it's always important to like double check and confirm that before you go back, because that is the other thing, is as you're going through the MRI, it is a long scan and you will likely have breathing instructions throughout. And so you need to make sure that you can hear the instructions as you go. Otherwise, it'll make your scan longer and it can also ruin the quality of the images. So it's really important that you can hear them throughout the process. All right, so now you've got your headphones on, you've got your music going, you've got your little squeezy ball. So from there, they've got you all set and they will head out of the room and start the scan. It'll take you into the machine and then you will start hearing the noises. This is something that I highly recommend to listen to beforehand if you want to. This helped me a lot in knowing what to expect. You can literally just YouTube MRI sounds and you can hear what it sounds like. And that helped me be prepared for the MRI. So I knew what the sounds were gonna sound like once I got back there. The other thing that has helped me is, like I said, I usually listen to some type of music, and listening to those musicals, what I would do is I would like lay there and I'd picture the sounds as like drums or something. I'd like try to make a pattern or something like that with the noises that the machine was making, something to distract me from like the actual scan that was going on and put it into a different context. I don't know if that will help for anybody else, but that's just something that I do to help get me through it. So once you're in there and the scan starts, they'll go through and they'll just start taking all of their images. You will slowly kind of move back and forth through the machine as they're kind of moving you into different locations to take the images. Then, especially for me and my liver and the abdomen, I have lots of breath holds. So they will basically say, you have a breath hold coming up, and it'll always say, breathe in, breathe out, hold. And basically you hold your breath while they take a bunch of images, and you want to hold very still while you're doing that, and try to be consistent with the amount of air that you're letting out. And this is one thing that I still don't know if I get it right every time. They're just breathing instructions. You wouldn't think that they're that difficult. But whenever they tell me breathe in, I breathe in really deep, and then I breathe out. And then I feel like I'm cheating because I hold like a tiny little bit of breath left, because I am not sure I'm gonna make it with exhaling all of my air. I know that's not an actual thing, but I just get it stuck in my head. But the biggest thing with that is just stay consistent. So I don't know the right amount of air you're supposed to exhale. I won't pretend that I do. The biggest thing, I've asked about this before, is just make sure you're consistent, and make sure you're holding really still and holding your breath when it says to hold your breath. I have several breath holds. They'll do all my images with those before the contrast, and then I get the contrast. Again, I don't really feel the contrast from an MRI. Sometimes it might be a little bit cold, but I don't really feel anything. And then we'll do the same thing with the contrast. The contrast is usually the last like 10 minutes or so. So the bulk of the scan is usually already done, and it's just like the last 10 to 15 minutes is the contrast portion. So that's usually when I know that we're about to wrap things up, and I just get through those final breath holds. And once I'm done with that, the tech comes back in and you're ready to go. So same thing, you want to drink a lot of water to flush everything out of your system. But then they'll evaluate your images, push out your report, and let you know. Reports, again, vary. It kind of depends on how quickly the radiologist can read the scans. For me, I've had scan results as soon as a few hours, and then other times it's taken a couple days. So kind of just depends on where you get your scans done and how busy they are. So I don't know if that's helpful, but hopefully it is. That is kind of what my experience has been with a CT scan and an MRI. Both of them I was much more worried about before I actually had several of them done. They can be pretty stressful, especially those first ones that you go through. It's the whole process about waiting for your scans and the results that I really struggle with these days. But the scans themselves aren't too bad. What else here? The other difference between a CT scan and an MRI is that with a CT scan, you are exposed to a small amount of radiation. But if your doctor has ordered a CT scan, that means that they think the benefits outweigh the risk. So you definitely want to still make sure that you get that scan taken care of so that they can check everything out and know what's going on. I'll say I really worried about the amount of radiation that I had. When I was first going through my scans, I heard people talk over and over again about how dangerous CT scans are. That honestly was part of the reason why it took me so long to be diagnosed, is because nobody wanted to scan me because of my age and they didn't want to expose me to the radiation. But scans are a very critical part of care, especially when you are a stage 4 patient. So it's really important to make sure that you're staying up to date on your scans and getting those when you need to. The other thing is, I had heard about how bad radiation is for you, and I thought that that meant, again, I had no medical knowledge at all when I was first diagnosed, and so all I had to go off of is information that I heard from other people. And so when I heard that radiation causes cancer and all of that, I was like, great, I already have cancer, like I'm terrified. Does this mean my cancer is gonna grow faster? Does it mean I'm gonna get another cancer super soon? For it being something that I was really worried and afraid of. But with radiation from CT scans, basically the amounts that you get from just one CT scan is relatively low. You still want to keep track of all the scans that you get and make sure that your doctors are aware of how many scans that you've had. But the radiation exposure that you get from a CT scan isn't going to give you cancer tomorrow, next week, next month, anything like that. And it's not something that they can predict super well. A lot of the information that they have on radiation exposure actually comes from the data and research from exposure to the nuclear bombs. But like I said, if you go for a scan, you're not going to be developing cancer tomorrow. And especially a small number of scans, your risk is still very low. And so always make sure you're talking to your doctor about these things. It's very important. I thought I'd just share that information because it was something that I really worried about when I first was diagnosed. I already had cancer. I really did not want another cancer, and I didn't know how any of it worked. I thought if I was exposed to radiation, I could just get cancer like that and I would have that cancer tomorrow, which is not the case, and it's not how it works. Doctors know what they're doing and they will keep you safe. Which kind of brings me back to the other thing that I wondered about when I first got diagnosed. I was wondering about how frequently do you get scanned? But like I said, I am not medically trained or anything like that, so I'm definitely not giving any advice here. But these were some of the questions that I had when I first was diagnosed. So I did not know how fast my cancer was growing. Nobody did, but I was terrified that from when I went from when we found it in the ER to those very first appointments and everything, I thought it was probably just growing like crazy. I didn't realize that this thing had probably been growing in my body for years, if not a decade or more. And so I was petrified and I thought I needed to be scanned very frequently. Now, my cancer has grown slower than some other people's cancer does, but basically your doctor will put you on a scan schedule that is appropriate for your disease. So in kidney cancer, the scan schedule oftentimes is every 3 months. And basically they will scan you every 3 months to do restaging and to evaluate if you are going to stay on treatment or discontinue and try something else. When I was first diagnosed, I know I was really worried about being put on a 3-month scan schedule. And I almost even signed up for a clinical trial that was going to be on a 6-week scan schedule because I thought it would be better to keep a closer eye on things at every 6 weeks, but that definitely was not necessary in my case. And there are sometimes some negatives to scanning too frequently, which is something that I did not know at the time. So I will use my case and give you an example of what that might look like sometimes. So for example, I got scanned right before surgery when we went in and we took out my right kidney. We cut out several sections of my liver and did a bunch of ablations. It was a very big procedure. And oftentimes after you have surgery for a nephrectomy, it can vary for everybody, but oftentimes they'll rescan you about 2 to 3 months afterwards. And that's usually to make sure that your body has time to heal and that they can make sure that when they go back and look at the scans, they can be certain of what they're looking at. So for example, when we scanned me only 1 month after my surgery. And basically when you scan that soon, there's still a whole bunch of healing and a whole bunch of stuff that's going on from surgery in there. So there can be artifacts from surgery or different things that appear on the scan that may or may not be something that needs to be addressed. And it can be difficult for them to tease out the difference when they scan that soon after surgery. I'm sure it varies from patient to patient, but that might be a reason that they might not scan you immediately after surgery. For me, we had seen a few spots that looked like they were missed, but we weren't sure if they were artifacts or not. And then we rescanned me about 2 months after that, and we did see that a few of those spots were growing. They grew 1 to 2 millimeters, but we had missed those spots, so we went back and we ablated them afterwards. Since then, I have been on active surveillance, which means I just go for scans. I am not on treatment at all. And we just scan me every 3 to 4 months to see how everything looks and make sure things aren't growing. And in my case in particular, my disease has grown so slowly, or at least up until this point, that it's very difficult to actually figure out if something is growing or not. An example of a downside to scanning too often, in my case, for example, is if we're scanning every 1 to 2 months, or even sometimes every 3 months, the growth might be so minimal that it's really hard to pick up on a scan. So to give you an example, here is an image of one of my scans. And basically how they measure the tumors is the radiologist has a program that they click and they drag from one of those areas over into the other area, and they manually draw to measure what the distance is and how big that lesion is. And with really, really small things, if you move even just a pixel on the screen, it might change the size there. With the larger ones, it can be difficult to get the exact same line every single time. So your scans can vary by a couple millimeters in those measurements. They're not like a perfect science or anything. So for someone like me, if I scan too frequently, it can be really difficult to figure out, okay, is that just a variation in measurement or is that spot actually growing? The longer I go in between scans, in my case, helps kind of differentiate between just a very small amount of growth and growth that is actually happening. I will caveat that and say that my case is very rare and unique, and so that is just the management plan for me, but I thought I would share that information in case it might be beneficial for anybody else, because it is something I really worried about early in my diagnosis, is I wanted to be scanned all the time so that we knew what was going on. Other examples might be if you have started a new treatment and you scan too soon before the drug has really been able to go into your system and do its job, you might see progression or you might not see shrinkage that could lead to you coming off that drug prematurely if that drug would have responded if you had scanned maybe like 6 weeks later or something like that. It's really important to trust your doctors. They'll make sure that you are set up on a scan schedule that is appropriate for your disease and the treatments that you're on. I thought I'd just share that information because those are questions that I had when I was going through my diagnosis. All right, and I guess I'll wrap it up here. I was gonna take you through my scan day of the latest scans that I just had, but I'll make a separate video of that. I will put that in the one that I am actually sharing my results, because this video got too long and I want to make sure that this stays tactical, and I hope this information is helpful for other patients. So stay tuned and I'll post those other videos hopefully here soon. Like, subscribe, do the things. I don't know where to point, but all right. Thanks everybody. See ya.